Today's topic, as you are all aware, is autistic spectrum disorder. If you have joined my previous webinars, you would be aware that I try not to give lots of information in these webinars, but what I try to do is bring in my own clinical experience, my learning from the parents I work with, whose children I'm supporting, and bring in all of that learning into these sessions. So yes, if you would need more specific information about the disorder or the treatment plans, I would be able to send you links which you can go on and read about it. And I would always recommend reading it from well-known websites who publish things which are evidence-based, like Royal College of Psychiatrists or National Autistic Society, places like that. So I'll be giving that information later. So the plan for today is I'll be talking briefly about what autism is. Then I will move on to the questions that have been sent to us already, and I will try to answer those questions. And then I will also answer the questions which you might have. In the previous sessions, we have noticed that there are often lots of questions and we're not able to cover everything in this 1 hour, but we then try to respond to as many questions as we can and send it to people who have asked. So that's also a possibility. So don't worry if your questions aren't answered. We will try our best to get back to you after this session. So I'll start off by talking about autism, autistic spectrum disorder. So there are 3 key things which define or help diagnose a person with autistic spectrum disorder. The first one is a qualitative impairment in the social interaction. This is the key thing, that people with autism, they struggle with the quality of their social interaction. And we'll talk a bit more about how that looks like. The second thing is there's a qualitative abnormality in their way of communicating. So example would be when we're talking to someone, we're not just speaking. There's a change in our facial expression. There are gestures. So we hear from, when someone is communicating to us, we do hear what they say, but we also gain lots of information from these other non-verbal cues, and it's a major part of communication. So that might be missing in people who have autistic spectrum disorder. And the third key thing is a very restricted, repetitive, and stereotyped pattern of behaviors and interests. So let's take an example of a child with autistic spectrum disorder. Unlike another child who, let's say, is playing with a car, the other child might use imaginary ways of playing with the car and treat it as if it's a sport car and move it around quickly. Whereas you might find an autistic child would be sitting there with a car and just move its wheel around again and again and again and keep on doing that for a long period of time. So that kind of repetitive behavior is part of autistic spectrum disorder. So other things that you might see autistic people do, they find it hard to communicate and interact with other people. That's the social bit which we briefly talked about. They find it hard to understand how other people think or feel. So they take very literally what people say, and the feeling or the emotional aspect of it is difficult for them to understand. They might find bright lights or loud sounds overwhelming, stressful, and this is because often there are sensory issues associated with autism. Not always, but often they are there. And people with autism might get very anxious or upset about unfamiliar situations and social events. They might take longer to understand information. And this is very important because when we are listening to someone, let us say if we're in a pub and where someone is talking to us, we're able to focus on what this one person is saying to us, whereas there would be other talks going on, other sounds, we kind of take them out of our picture and quite focus on what is being said. But often the people with autistic spectrum disorder, they are not able to do that. They can't filter out the key thing they want to listen to. So not only are they trying to process the information this person is giving them, they also have to process this other information coming from other sides, which is not useful to them, but they find it difficult to filter it out as compared to people who are neurotypical. They would do the same things over and over again, and we'll talk a bit about why that might be the case. So if we then look at the signs of autism in younger children, in day-to-day activity, we might see that they find it difficult to respond to their name. So even if you call them by their name, they might not respond. The second thing is avoiding eye contact. You would find that quite common. But at the same time, just because a child is avoiding eye contact doesn't mean they have autistic spectrum disorder. There are lots of reasons why a child might be avoiding contact. And that's why when we make a diagnosis of autistic spectrum disorder, we have to take lots of things into consideration. And it's quite a comprehensive assessment where we look at each feature which might be attributed to autism and rule out other things that might be causing it, so that we're not labeling something else as autism. For example, if someone has attachment disorder, it might look like the child has autism, but we have to be very careful before diagnosing. Young children might also find it difficult to smile when you smile at them. They might get very upset if they do not like a certain taste, smell, or sound. And they might do the repetitive movements such as flapping their hands, flicking their fingers, or rocking in one place. They might find it difficult to talk as much as other children, and they might repeat the same phrases again and again. The repetition of the same phrases is almost helping them to soothe themselves. So that is the key purpose often of it. Then if we look at the autism in older children, you might see slight difference there. That's they might not seem to understand what others are thinking or feeling. They might find it hard to say how they feel. And that is the key point of autism, where the development of understanding of their feelings or emotions isn't as good as a neurotypical person would be. So they might also find if there isn't a strict daily routine, that might upset them. They get very upset if you ask them to do something. That's a possibility. They might find it hard to make friends, or they might prefer to be on their own. So often when we're doing the developmental history, we do ask about the child. Was the child, when in nursery, would they be most of the time found on their own, or would they be part of a group? So you might find a child who's on the spectrum spends lots of time on their own. But again, just because a child is spending lots of time on their own doesn't mean they have autism. It might be one feature of autism. And children take things very literally. For example, if you say to them a phrase like "it's raining cats" or "cats and dogs," they would actually look out of the window and say to you, "Well, there are no cats or dogs." So it's that literal. Then a key thing that often is asked is the difference in autism in girls and boys. There is a difference in the presentation of the girls with autistic spectrum disorder. You might find autistic girls, they're much quieter. They are able to hide their feelings much more, and they may appear to cope better with social situations. They have an ability to learn and almost imitate social behaviors, which might then give an impression that they don't have autistic spectrum disorder. Now, autistic spectrum disorder does not often come on its own. There are other comorbid conditions, and hence we have to be very careful. Just when someone is diagnosed with autistic spectrum disorder, that by itself might not be enough. We might need to look whether there are other comorbid problems as well. Often you would see with ASD, there might be learning difficulties, there might be ADHD. If it's not diagnosed early on, you might find lots of anxiety in people who have autism. And if the anxiety isn't managed well, then it might lead to depression over the period of time. Now, as I was saying earlier about these behaviors that we see, it's important to understand why would a child with autism or a person with autism want to have the same routine. Why do they find it difficult when their things are changed? Why do they like the repetitive behavior? And why do they find it difficult to socialize? I think at the core of it is that a person with autistic spectrum disorder almost find it difficult to integrate themselves as people. So we have lots of features as a person and a personality, and we all might feel we are one or a single person, but uh, you might find that a child with autistic spectrum disorder is not able to bring it all together. It's as if they are different islands separated from each other. Um, and if we compare that with a neurotypical person, they also have different parts of them, but these islands have almost come together. They can feel themselves as one integrated person. And when a person does not feel that integrated, they do feel like these different islands separated from each other, then there's a need almost of control, some kind of normality, a control, and that's what leads then to the need for having a specific routine, following it, wanting to know in advance what's going to happen, meeting only people who they know. So all of that, it all comes through in that. Also, people with Asperger's. So there are people who are Asperger's and have some, let's say, some specific skills. They might have a high IQ. They might have a very high specific sensitivity to things. For example, there was a child with Asperger's who had such strong sense of smell that if you would bring three different Heinz cans from three different superstores and give it to them, they could smell it and tell you which superstore you have brought it from. Not only that, the visual also, the light sensitivity to light can be an issue, and the sensitivity to various things can be an issue. An example is there was a child who was on the spectrum and used to have a social worker who would visit him often. And on some days when this social worker visited him, he would get really agitated, irritated, and didn't want to see this person. And then somehow this social worker figured it out that the day she was wearing earrings, which were shiny, the child couldn't manage it. The reflection from it would just put the child off, and he wouldn't be able to interact with this person. That's one example. The another example was of a child who, if the social worker came to his home and had been in the rain, and their coat, the jacket they were wearing, if it had some droplets of water on it, that pattern would upset the boy so much that he wouldn't be able to look at this social worker, and found it very difficult. So there are lots of such things which can have an impact on the child or the person who has autistic spectrum disorder, and then can present in form of behaviors which we feel don't have a trigger to them. We feel, well, where did this behavior come from? There, most of the time, there is a reason for it. It might be sensory, it might be anxiety. So once we're looking at supporting young people with autism, those are the things to bear in mind, what is actually causing this behavior. So I'll now move on to the specific questions that have been put to us. So if I go to the first question, it's about mainly about school. How can the school staff help during school hours in mainstream schools? So again, if we go back to the core issue, which we talked about, that a child with autistic spectrum might feel as if they are not as a one person together, they're not integrated enough, and they feel the need of control. If we start from that point, if we also start from the point that because of this need of control and feeling that way, they might feel anxious. Once we bear that in mind, then it would help us support them in the school. The other thing to bear in mind is, are there any comorbid issues? Is the child having high sensory issues? Is it that they are not able to bear a loud sound, or if there's light, is that an issue? If there are lots of children around, the noise and the feel of having so many people around, is that having an impact on the child? So with all of that information, we can then have a program for the child in the school, and it has to be tailored to the child. You can't have one size fits all, because each child with autism would have their different needs. And one key thing is, which was asked, is when a child with autism is starting school, what would help? Again, with any of us, if we are anxious about doing anything, it's always better to do it in steps so that we're not suddenly flooded with lots of emotions and cannot bear it. But if we take small steps, then that would help us integrate into all new situations. And particularly in children with autism who anyway are struggling and are hoping to find some control, they need more of it. So if it's going to school, it might be a good idea to start off by talking about the school. Then it might be a good idea to showing the pictures of the school and slowly taking them to the school and introducing them to the class. So doing it in stepwise manner, and always planning it in advance and informing the child in advance so that they are prepared for what's coming up. And then based on the sensory needs, based on other needs, one particular one is ADHD. It might be one of the most common comorbid causes with autistic spectrum disorder. And in ADHD, the child might have impulsivity, they might be hyperactive, they might find it difficult to concentrate. So if that is an issue, we need to look into that and help them with some medication or other things to support them in the school. And schools, I work with lots of schools. They always find it helpful if clinicians who have seen the child are able to give them information about the specific needs of the child. And if it's done in a coordinated, cooperative manner between CAMS and school and parents, it's always the best way forward for a child who is going to a mainstream school. The next question is, any top tips on dealing with school phobia, high anxiety surrounding the transition into school, please? Our daughter is 14 and has sensory processing disorder too, a hearing impairment and some cognitive difficulties. Her love is horses. So again, this question is a very good question and highlights the complex and multifaceted needs of a child. Means any child has different kind of needs or different things that they like or don't like. Similarly, in a child with autism, if they have sensory processing disorder, then ideally they should have had an assessment by an occupational therapist about their sensory needs, and they should have given some recommendations which can then help the school tailor the environment to this child. And if this child has hearing impairment as well, the key thing to remember is, going back to our earlier thought of a child with autistic spectrum disorder, if they are feeling so much lack of control in themselves, then on top of that, if you're adding sensory processing disorder, that is any sound or any loud sound would startle them. So that's another lack of control. And then where there's a hearing impairment as well, so another loss of control there. So this child would need lots of support, and with each of these needs that the child has. And then cognitive difficulties, again, a cognitive assessment would highlight the specific learning difficulties, and the school program and the environment would need to be tailored to her needs. She loves horses, so that's a really positive thing for her, in the sense that when we all get stressed, we want to do things that we love so that that takes the stress away. For her, having regular contact with horses would help her a lot. I have had children who similarly loved animals. They wanted to work with horses, and just having 1 or 2 sessions a week or even 3 sessions a week changed their life a lot. It was a really fulfilling life for them. They were much more happier when they were able to do that kind of thing. So yes, really positive to find out what the child loves and what they like, and then trying to put in as much of it into their day-to-day daily routine. The next question is, there seems to be an increase in the diagnosis of ASC in children. Is there a reason for this? There could be multiple reasons for it, but one of the things that often happens is, once the information about a new condition becomes more common to people, once people start knowing that, well, if a child has this problem, there is a solution or there is a way of understanding it, then more people would want to look at getting a diagnosis of ASC in children. So that is one of the reasons that we can say. There have been some news in the past about some vaccines might be causing more of it. That's not been substantiated at all. So it's more about getting a diagnosis and helping the child. So that's the important bit, rather than not worrying that if we go for an ASC assessment, then what's going to happen. So take it in a positive way, in the sense that the child would get the right help if they have ASC. The next question says, more information needed at schools. I'm not sure exactly what this question implies, but what I'm making of this question is that the schools should have more information about autistic spectrum disorder. I know over a period of years, there is much more information available in school. There are SENCOs in school. There are specialist counselors in schools now. And obviously, there are educational psychologists in the school who have a key role in informing the schools about this condition. Not only that, the local CAM services, that's child and adolescent mental health services, have now more proactively started working with the local schools. Clinicians go into the schools, they talk to the teachers, they talk to the SENCOs and explain the condition, and also they provide consultation if needed. And there's lots of websites which provide information. National Autistic Society does lots of, they have parenting courses and things like that, which can be helpful for the schools. Next question is, how can schools better identify possible ASC in a child who masks at school? That's a very important question. How do schools identify? ASC, as I said, again, to diagnose someone with ASC is a comprehensive assessment. It takes lots of time. It needs lots of information from various sources. And the key thing is you need to rule out some conditions which might be similar to ASC, like attachment disorders, like severe anxiety, like learning difficulties. So when you meet with a child with, let's say, a high functioning autism or severe form of autism, there is almost a feeling that there is no social connect with the child. So the child might be treating other people as if they are not humans, like they're objects or toys. They don't mean to do that, but it's because of the social communication difficulties, and so that's a feeling you might get. Whereas if a child who has attachment disorder, you might find the child is almost keen to have either get almost go overboard to have a social relation, or find it very difficult to even try and become social. You can see there's an anxiety element to it. So a child who is presenting with mostly being on their own, they don't like the company of other children, that might be an indication. But again, these children might be anxious, and that's why they are finding it difficult to interact with other children. So that's one of the things. If a child is more involved in repetitive behaviors or rituals almost, that's another thing to watch for. But again, a ritual might be part of autism, or it might be part of obsessive compulsive disorder. So again, it's important. And the difference between the two is, in autism, it's more ego-syntonic. So the child almost likes doing it because it helps them soothe themselves, like repeating the same phrases, or just twirling at one place and going round and round. Whereas in case of OCD, it's part of the anxiety, and it's a ritual done to reduce the anxiety. So that's the other aspect of it. If what you might see with children with autism, they are not able to use proper pronouns. They would say you for I, or I for you, and that's again the aspect where they find it difficult to have the feeling of a joint them, or an ego, individual person, and that's what makes it difficult for them to identify themselves and I. It doesn't happen in all the children with autism, but that's also a key thing to watch for at school. Or use of the repetitive same phrases, that's also to watch for in school. Next question is methods to address focus and redirect attention. Again, a very good question, and the answer isn't straightforward because, as I was saying, autism comes with lots of other aspects to it, like sensory issues, like comorbid ADHD, like anxiety, or even depression. So to address the focus, first of all, you need to find why the child is finding it difficult to focus. Is the child finding it difficult to focus in the classroom because of sensory issues, i.e., is there it's a very noisy environment, or is there too much of light in the class? Is that a sensory issue, and that's why they're not able to focus? Or is the child too anxious, and the anxiety of being in the class is not allowing them to focus? Let's say a child is being bullied by other children, and the child who bullies them is sitting next to them or behind them in the classroom, then obviously the child is going to be anxious most of the time, and that won't let them focus. Or if the child has ADHD, then that might be a reason why they're not able to focus in the classroom. Other thing is, if they have specific learning difficulties, then that won't allow them to focus in the class, and again, that might lead. So these are the things to find out. So first, assess the child's need, and that won't be a straightforward thing. It will need input from various people. So it will be from the teacher, it will be from other children, it will be from, let's say, educational psychologists in the class, from parents. So all of this information together would get us an understanding of why the child is not able to focus. Once we find the cause, then finding the solution is not that difficult, and redirecting attention would come from that. Next is interested traits, specifically in girls. As I mentioned earlier, it's slightly different in girls, and unfortunately they do go under the radar a lot because girls have a very good almost social intelligence to pick up the social cues and to learn much more quicker, and are able to repeat that, and hence it's probably difficult to diagnose them earlier. But often in puberty, you will find that even girls who have ASD and have been able to kind of manage, they might struggle it, and you would find lots of ASD diagnosis happening in girls in their adolescence rather than much earlier on in life. Next question is about separation anxiety, school refusal, verbal aggression. So separation anxiety, again, it's part of the anxiety of the child itself with autistic spectrum disorder. Then the anxiety might get even worse if they find it difficult to separate from the parents. So we would need to address each of these aspects. And school refusal could be because of various reasons. I'm sorry, I'm not able to give one specific answer to a specific problem because there isn't one. There isn't a magic wand, or there isn't one magic pill for any of this. The key thing is to understand each problem in very specific detail. And once we understand that, then we are able to help them. So coming back to school refusal can be because of lots of reasons. And particularly in child with ASD, school refusal could be because going to school itself is a major transition from home. And just getting to the school means the child might have to go, let's say, in a school bus, which is another environment. Unpredictable. There are lots of children in there who might be doing different things. So that unpredictability would make them anxious. Then at school, if they're entering the school, it's very noisy. That would make them really anxious. So similar things. Once we understand what is making this child anxious, then we can help with the school refusal. It's not necessarily that the child is refusing the school just for the sake of refusing. No, they might be interested in going to the school, but why they're refusing it is it's too anxiety provoking to go to school. So once we see it from that aspect, then we could help them to be able to go to school and enjoy going to school, because key thing is to enjoy it. This is a place where they spend so much of time. If it's not enjoyable, then half of their life at that time is spent in worrying, and we don't want a child to be in such a situation. So yeah, very important. Third is verbal aggression. As with anyone, we might resort to verbal aggression if we are angry, if we are very anxious and we're being almost forced into doing things, if we're very irritable. So the verbal aggression again can be because of various causes, and we need to find out what is the cause which is leading to verbal aggression. A good way of finding out is, where is this aggression happening? Why is it happening? With whom is it happening? And what happens once the verbal aggression is there? What are the consequences of that? Is it a behavioral thing where they have found that once they are verbally aggressive, they get what they want? Or is it because they are feeling very anxious and they want to be on their own, and they have found out that the only way to get people away from that is by being verbally aggressive? I often see children in my clinic who have got ASD, and once they come in, they are almost rude. I know they don't mean to be, but that is almost a defense mechanism, because here this child is coming into this clinic to see a professional. He has never seen me. He knows he's going to ask me lots of questions. That will increase his anxiety, and the child might start being rude to me. But the key thing I have found in my clinical practice is, if a clinician is able to stay with it, as in let the child get their anxiety out in whichever way they are trying to do it, keep on reassuring them, answer all the questions they have. Because once a child I saw questioned my qualification, questioned my clinical experience, and I think I spent the full 40 minutes of my first assessment explaining to them how I became a doctor, what my degrees are, where can they check whether I am actually a doctor and whether I'm actually a psychiatrist. And when I did all of that, in the next session, the child was able to focus more, was able to interact more, and then developed such a strong faith in me as a clinician that it was so easy to understand the child and to help the child, discuss the medication with them. They had so much of faith, and it was a treat working with this child, just because we had spent some time understanding and allaying their anxiety and letting them know me more and developing that relation. So in children with autism spectrum disorder, it's a key thing to let a relation develop. If we come in and want to make changes from the day one in the child's life, that's going to be very difficult, almost impossible. That was about verbal aggression. Next one is it normal for picky eaters? This is not a complete question, but it is about picky eating. Probably it's that our children with autistic spectrum often picky eaters. When you say picky eaters, it almost has a negative connotation to it, but the way of understanding it is, again, sensory needs. So if a child finds it difficult to eat anything which would make a crunching noise while they're chewing it, and their sensory, they can't bear that sound, then they won't eat it at all. That doesn't mean they're picky eaters. They're just trying to get rid of any anxiety which might be caused by eating a food which is causing crunchy sound. Or the texture of the food is important as well for lots of children, whether it's a solid food, whether it's a liquid food. So those kind of things. So once you know what are the sensory things that are important to the child, you could then help them find the right food for them, and then get a balanced diet for them. So it's not necessary that if a child likes chocolates or that kind of texture, then that's all you're going to give them. We can find something else which has similar texture and is much a healthier food. So it does take lots of time. A good idea is also to talk to a dietitian if we're finding it difficult to know whether the diet is complete for the child. We can do that, but the key thing is to find the right diet for this child. Next question is how to make a child understand her emotions and express them without getting upset or violent. Now, this is a very important question, because when it comes to autistic spectrum disorder, we're dealing with children or young people who find it difficult to understand emotions. It's not only other people's emotion, it's about their own emotions. So a child with autism might be angry, but would not understand what it is. What is this feeling they are getting? And if no one tells them, they would not be able to understand it. With neurotypical people, it's probably, or it is much easier to understand the emotions, but they would also struggle if the parent wouldn't help the child understand the emotion. Giving you an example, so if a child, 1 or 2 years old, falls down, hurts his knee, so first thing that a parent would come and come closer to them. The way they talk to the child would make the child feel that the parent is empathic to me. The child would say, "Oh, you got hurt," and the child would, that would relate to how the child is feeling, and the parent might say, "Does it hurt a lot?" And that would also kind of synchronize with what the child is feeling. And then the empathy and the love and the caring that the parent gives is something that the child internalizes. They know, well, if I fall down and some feeling comes in, it is called pain, and that pain can get better by doing things. And also, if you get too much hurt, you are crying because it hurts so much, you feel sad. And once the parent says these things to the child learns. Similarly, in children with autistic spectrum disorder, they would have much more difficulty in understanding these emotions and later on to express them. So the parents, instead of focusing too much on giving uh, practical or general knowledge kind of thing, should focus more on the emotions of the child. So playing games where it's more of imaginary play, or games where emotions are talked about. So the earlier we do this with the child who has autistic spectrum, the better the results would be. They would be able to understand more. And most of the results are, the earlier in the childhood these kind of supports are put in place, the better the outcome is. These are the questions that were sent to me earlier. I'm now trying to find out if there are any questions which are been coming to me now. So there's the first question is, my son has sensory issues with clothes and shoes. He's not wearing jacket from this winter, whereas last winter he only wore fabric one. Tried all types but failed. About shoes, it's very hard to get him on new shoes after size up and wear only Nike brand. Need your suggestion and help, please. I'm totally helpless. Again, when we're talking of sensory issues, it's about the type of cloth or type of fabric that has been used, or even the kind of laces that are in the shoes. So there are lots of things that would have an impact on the child. One of the things I often say to the parent is get a sensory assessment done, because this child has lots of sensory needs there, and specific sensory needs. It's about fabrics, and you have tried as a parent to find the right one for them, but if you are not able to find the right shoes for them, it is a good idea to talk to an occupational therapist who would be able to do a sensory assessment and then specify what kind of things would work best for your child. It's possible, as you said, they like Nike shoes. What is it about Nike brand? Is it the brand that they look at and they like the shape of the logo, or is it that the Nike brand shoes use a specific kind of fabric which they find most soothing or least repulsive, if I could use that word, and hence they like that kind of shoe? Yes, getting the shoe up, as you said, if your size up goes up, they're so used to using a specific shoe, they like the feel of the shoe. Going up to a different shoe would be a big change for them, because it's a sensory issue as well, and then it's a new thing for them. So we have to find a shoe which is very similar feel. I don't know whether you can use the same socks that the child uses with the previous shoe, use the same socks with this new shoe, so that they at least have some kind of transition object from the previous shoe to the new one, which is the socks that they're wearing. So these kind of things you can try, and as I said, maybe get a sensory assessment done if it's not been already done. If child is non-verbal, it is possible to still develop speech. Is it possible to still develop speech? It means, I guess what you're trying to say is it possible to develop a way of communication if the child is verbal? And if that's the question, yes, it is. And going back to my initial statement when I was talking about communication between people. We only communicate a small part through our speech or spoken words. The rest of it is communicated by non-verbal gestures and expressions. So yes, the communication can be developed, and you would need more specialist help than I can say in this session. In a lesson situation in secondary education, are there direct reactive things staff supporting an autistic child can do if there is a sudden behavioral outburst that are positive and productive in the moment action? Then discover cause after lesson by breaking down. So that's a very important question that has been raised, is about the behavioral aspect. I didn't touch on it, briefly touched on it. So often I get referrals about children who have diagnosis of ASD and their behavioral difficulties, particularly about hitting out, shouting, breaking things, and in the class, and having emotional outbursts. And again, to be able to support the child with the behavioral difficulties like these, we have to again go back to the basics, try to understand what is causing this presentation. Is it the anxiety of the child? Is it the sensory need of the child? Is it that the environment is there's a new teacher? Some children find it difficult to adjust to this new change, and it takes some time for them to settle down after a new teacher has come in. So that's something to look at, and then support them. And in this case, it was a sudden. What can be done immediately? Well, it's difficult to say what specific thing can be done, but given the child's history, if a person knows the child and knows what has worked for them in the past, they can do that. Some children who are who are very sensitive to sound, they might respond well to having ear muffs. Some children who are sensitive to light, they might want to go in a room where there's less light. They might feel better if they are allowed to go out of the room to a place where there are not many people around. So those kind of things could help. If the child is getting even more aggressive and these things haven't helped, it's always an option to refer to CAMP service. And if a child is too anxious, we can support them by giving them medication to reduce the anxiety. And once the anxiety is less, then more behavioral work can be done with them to help with their behavior. The next question is it possible that ADHD is causing a child's exhaustion when they are stuck in a loop of constantly stimming and echolalia, waiting for a diagnosis of ADHD, have ASC1? Well, if we are doing the same thing again and again and again without taking a rest, yes, it can cause exhaustion, but then it also, the key thing would again be, why is the child doing this? Often echolalia or repeating the same sentences or phrases is a soothing thing for the child. And is the child under more stress or distressed by other things or very anxious, and then they have to do this behavior so that they can manage their anxiety? That's something to look for, and then that would help them. With ADHD, often children who have ADHD, they are so active, and exhaustion is something that I haven't seen with children who have ADHD. Yes, once they go to sleep, it does take a lot of time for them to go to sleep, but they might wake up in the morning and suddenly they'll be up and about without feeling the need to slowly get up and do things, because that's part of the ADHD, the hyperactivity which comes with it. So that's where the diagnosis bit would come in, and specific needs of the child would be ascertained. There's a second question. Do you recommend using step-by-step visual journals with breakdown of days routine when starting secondary school? Is this useful tool to create structure in secondary school, which is much busier with room changes than junior school? Totally agree with that. Anything which allows the child to have a structure, and often I find that children who might not have been diagnosed in primary school, once they move to the secondary school, they found it difficult to cope there. And then once further assessment is done, they might be actually on the spectrum. And this happens because the structure in the secondary school often isn't as specific as in the primary school. The secondary school often is much bigger. There are much more children there, and the child who is on the spectrum and already finding it difficult to gain some control of their life are then suddenly in this big pool of children, and they are finding it even less. The situation even less controllable. So anything which allows them to gain control, as you said, visual journals, because that's a step which will remind them of what to do next, and they will almost know the routine. That would help them, and the teachers could help with setting that up. Again, as I said, it depends on each child, and it should be tailored to each child. Next question is, any advice regarding the impact of COVID on routine and structure of school? My son is struggling during lockdown, much anxiety regarding COVID. This is a very important question again, and I can spend lots of time answering this question. But if you look at children who have obsessive compulsive disorder, they have struggled a lot during the COVID time because of the scare of getting infection with COVID. Some children have found it really helpful in a way when the lockdown came in and they didn't have to go to school, because if they were anxious around school, staying at home helped it because they were not going and meeting lots of different people or new people. Having said that, some children who benefited from the structure that the school provides really struggled at home, and I know few schools had allowed some of the children to come to school and they found it really helpful. But in your case, you're saying your son struggled during lockdown, much anxiety regarding COVID. So again, if the child is having that much of anxiety, first of all, obviously reassuring the child, talking to them about their anxiety and saying it's okay to feel anxious, because all of us are feeling anxious, and often children pick up from the anxiety of the parents. Listening to news where they're talking about so many people dying and talking about the spread of the infection, that doesn't help, because children are always absorbing that information. That would make them much anxious. And if you find the anxiety is having a severe impact on the child, then it's a good idea to see the GP and, if need be, talk to CAMS about it. Next question is, any tips for sixth form uni interviews for our year 11 newly diagnosed highly functioning ASD daughter? A difficult question. I think as parents, I always say to the parents, please focus on the mental health of the child. Please focus on their emotions and both understanding and supporting their emotional needs. Because once, as parents, we support them with that, they would then take care of the rest. Education would come on its own, or preparing for these things would come on their own once we have looked after their mental health. Because any child who is anxious or worried is not going to do well in any exam or any interview, things like that. So supporting that. Because it's your daughter is on the ASD, she's on the autistic spectrum, it might be a good idea to help her prepare for the interview in the form of what would be the room like, what are the people who are going to be there, what kind of questions would be asked, and also to check whether your daughter does need to look into the eyes of the interviewer when they're asking questions. This is very important, because in my clinic, when I have children who have autism, I do talk to them and say, look, you don't have to look at me when you're talking to me, because that's an additional source of information or information overload for the child. Not only they have to listen to me, they also have to then look at my facial expression. For a neurotypical child, it's okay because they can filter out other things, but for a child with autism, they might struggle with all of this. So to check with the interview panel, if possible, that is it okay if our daughter doesn't look you in your eyes, because that will make her more anxious. She might not be able to perform to her full potential. So these things, specific things, could possibly help with the interview. this is the first time I have been asked this question, so I'm just trying to find what things in the past I have suggested and bringing it together for your question. I hope this answers your question. I think I missed one question, which was about PDA. Now, PDA is a condition which is considered as part of autistic spectrum disorder, and lots of parents do ask about it, and they say how to support the child with who has got PDA. Now, it's more the full form of it is a persistent demand avoidance. That is when children with on the spectrum are asked to do something and they feel under the pressure of having to comply to that request, then they are not able to do it because it's too much of anxiety. Again, going to what we talked about earlier on autism, if a child is on the spectrum and they are asked to do something which they didn't predict, that would make them anxious. And there's lots of research being done on PDA, but the key thing, what it boils down to, is give options to the child. So if you can't help, as in that situation, you have not been able to give enough forewarning to the child, and you do need to get them to do something, then it's better to give them two options. And then the child would have some control on what they can do, rather than being almost told to do something where they have no control, and that would make them anxious. We help them reduce their anxiety by giving them options. So once there are options, they could choose one or the other. It will be anxiety provoking to be expected to do something, but once the options are there, that helps them a bit in gaining the control in that situation. Okay. I think I have come to the end of all the questions that have been put to me, and we've got about 4 minutes left. And I will hand over to Holly, or is Greg around? Yes, so I would like to introduce Greg Macon, who is another co-founder of Welltech Medical, and he has lots of experience and education in the education background. And I would let you introduce yourself, Greg, and take over from me.
Thank you very much. It's been it's been a privilege to hear your experience and training, Dr. Warikoo. And many themes and insights which you have resonate with me and my experience in schools and leading schools. You just mentioned avoiding binary decision making or binary conflict and leaving things open for a third way to give a child a sense of control and not being trapped in a decision. And that is certainly something that I come across very often with children, and it can ease a pinch point so almost magically if the parents or the teacher or the carer can find a third way, or just to open up the choices and give the child a sense of relief from that binary choice. Also, being in touch with quite a few employers and college and school leaders, they are increasingly recognizing that children, rather than being seen as having problems, often have huge talents and strengths in quite surprising and interesting areas, which are very employable and can be tapped into, which help the child and are sought after by employers and colleges. And emphasizing those strengths and using it as a base to build confidence is increasingly recognized in schools and education. And I've spoken to an employer recently who actively looks for particular traits because they know how valuable that can be to help their endeavors in their business, which was in fact pharmacology and medical technology. So there are some positive sides very often which can be tapped into through an understanding of the young person. So that is something which education and employers are becoming more aware of as a society. We learn about how to look after and include people who are neurodiverse. So the assessment side of things to help understand is key to all this. And Dr. Warikoo's insights of awareness of sensory, whether it's eating sounds, which can inform diet, or sensory distraction, which normally we're used to without even realizing it, tuning out. All these things are very complex and create an unknown landscape for people when they first encounter this. So with assessment and with a bit of extra awareness and looking for help and not feeling the pressure to do this all by oneself, great progress understanding can be made for the child and indeed the families and carers involved. So thank you very much, Dr. Warikoo, for sharing your vast experience, much of which is very reassuring. There are many ways to move forward, and the important thing is there's no need to do it alone. There is help out there, and shared experience is such a valuable thing. So thank you for sharing yours with us all today, Dr. Warikoo. The recording of this session will be sent out and forwarded to everyone here in this session, with some links to useful information and with links to registration for future events like this. The next one is about dealing with behavioural issues, so that might be of interest to some of you. But for now, thank you very much for attending and have a good evening.